To transform Thailand with digital, we need to start from micro to macro approach. We selected two specific areas, which are education system and healthcare system, for following reasons. First, because Thailand is a medical hub of Asia and is ranked to the top 6 in best healthcare system in the world, Thailand can become a global medical hub by using digital technology. Second, because of Thailand's inequality and insufficient education, many Thais are considered educational laggards according to the low ranking of Thai students by international assessment. In Thailand, there has been an equality gap, so our strategy to transform Thailand we are divided into two parts, which are urban area and rural area. To transform Thailand education, we created the application called Influencer. It is a peer-to-peer online learning application that directly connects learners to instructors. Our application provides lots of courses by the instructor, which are anyone who specializes in their area. And learners can learn anywhere, anytime through their mobile device.
The reason why we create this application because we would like to build 4C: cost saving, creativity, connectivity, and community. Cost saving is decreasing public expenditure with e-learning space. Creativity is transforming education with digital technology. Connectivity is borderless learning experiences by peer-to-peer learning. And the last one, community, is setting up digital community among people from different backgrounds with lifelong learning.
Next, healthcare sectors. Our plan is to bring data from different healthcare providers on blockchain system, which improve healthcare in 3 main areas. First, smart health record. Smart health record is the online collection of patients' information from various healthcare providers. When the new data is added to the system, the record is automatically updated. If someone wants to access the record, they have to know the electronic ID card or ID number for those records. This technology helps shorten medical service and ensure the data privacy and security.
So the next one is prescription. Prescription allows doctors to prescribe the medicine remotely for patients. So this is how it works. Doctor electronically prescribe medicine to the system, which will automatically be updated to the patient's record. And then the patients can go to any pharmacy they prefer and present their ID card to the pharmacist. The pharmacist will then access to their smart health record and retrieve the data about the prescription, and then issue the medicine to the patient. So the doctor visits are no longer needed for repeat prescription, which will save their transportation costs and their time. And the last one, which ambulance. Which ambulance allow the doctor and the ambulance crew to access to the patient's data before they actually meet them at the emergency scenes. So how it works is when there is an emergency call, the system locates the location of the call and connect to the quickest ambulance possible. Then the ambulance crew will ask about the patient's ID card information so that they can access to the patient's smart health record before they arrive at the scenes to prepare proper first aid. So when they arrive, they will assess the patient condition and update it to the smart health record so that the doctors can review them and prepare for proper treatment. So when the patients arrive at the hospital, doctors can aid them immediately.
Rural areas. We will set up the healthcare and education center in rural areas. There will be many digital devices in the centers, so people can consult directly to the doctors, and they can also learn via application that we created on these devices.